Good morning, doctors. Welcome again. Today we are going to discuss about pediatrics clinical important one-liners. These one-liners are really helpful to crack NEET PG, AIIMS PG, PGI, jipmer, plab, usmle, etc. because these are very high yield and clinical based, which makes your basic stronger. Okay, let's start. A 4-year-old baby has generalized tonic-clonic convulsions and fever 39 degrees Celsius. His mother informs you that this has happened 3-4 times before. So diagnosis here is febrile convulsions. Why this is not epilepsy? Because epilepsy there is no relation with temperature. Okay, in children's that is febrile convulsion. Okay, a child present with clean wound, never been immunized, at his parents worried about it. No contraindication to immunization. Best management here is give full dose of DTP, full course of DTP, diphtheria, tetanus, and pertussis. Okay. Now, continuous machinery murmur, well known features of continuous machinery murmur we see in PDA, patent ductus arteriosus, okay, that is closed by indomethacin. Okay, 12-year-old child with episodes of sudden bluish discoloration and brief loss of consciousness. Exam clubbing, central cyanosis, systolic thrill with systolic ejection murmur, second left intercostal space. The diagnosis here is TOF, that is tetralogy of Fallot. Okay, in tetralogy of Fallot we see VSD, ventricular septal defect, overriding of aorta, and right ventricular hypertrophy and pulmonary stenosis. Okay, Paul Bonnell test positive in glandular fever. This is positive in glandular fever. So guys, if you remember in this way, that will gives you a lot of confidence, and in exam no need to see even option, you can write answer directly. Podocyte fusion on electron microscopy seen in minimal change disease. Even this year 2020 they give some clinical question and give podocyte fusion on electron microscopy, so it is visible in minimal change disease. Answer is same. Okay, 6 weeks child both with vomiting, constipation, and decreased serum potassium. The diagnosis is pyloric stenosis, which is most common early childhood. No duodenal atresia because no bile in vomit. So the investigation of choice with 6-week child with pyloric stenosis, diagnosis is USG ultrasonography. Okay, child FTT, that is failure to thrive, constipation, macroglossia, prolonged neonatal jaundice means decrease in metabolism rate. So answer here is this is a case of congenital hypothyroidism. Okay, now 6 weeks child present with progressive cyanosis, poor feeding, tachypnea over the first 2 weeks of life, and hollow systolic murmur. Diagnosis here is tricuspid atresia. It is due to tricuspid atresia. Okay, 6-year girl started wetting herself up to 6 times per day. Most appropriate treatment should be, this is not normal at 6-year girl, so we have to give behavior training first. So behavior training is the answer here. So guys, I hope these are very high yield one liners. Lot of exams they like to ask, most repeatedly they like to ask. So please study well, learn by heart. Thank you, good day, goodbye. That's all for today. And if you are new on my channel, please subscribe it.